Well, thank you so much, Brent, for those extraordinarily gracious remarks, and even more for our career-long friendship. I have no coach, mentor, friend, supporter that I value more than you, Brent, and you're a gift to me as an individual and to our whole worldwide effort. It's an honor to be with you. And it's an honor to be with all of you. The IHI Forum is it's just the peak of my year. Every year I come here and I just cannot believe the energy and the generosity and the learning and the feelings. It's just, it's extremely joyful. I could spend my entire time in a series of thank yous. I wish I could do that. I want to give a special call out to the blue shirts here who just make this possible every single year. In the background now, we've counted 20 straight years of support from Joe Martin and his amazing team with Audiovisual One. They make it look easy, but it's not easy. And Joe, I just want to thank you for your tremendous support. You couldn't ask for better partnership. I want to say a word of welcome to Melissa Panagitis-Bush, who I think is about 100 days into her leadership as IHI's new COO, and already having tremendous impact on the way this very large now and complex organization works. So Melissa, welcome, and it's just a pleasure to be working with you. And I would be remiss without a tip of the hat to Kedar. Every time I look at Kedar and realize the generational leadership that's gone on in this organization and how good, into what wonderful hands it has now come, I feel unspeakably grateful to Kedar for what he is giving us all. I love that walk-in music that Joe and his team always offer. It's a calming, kind of been through 4 days of tornado, and now here's a little bit of a calm breeze. And I think in that spirit, I'd like to start with kind of an unusual reflection with you and maybe participation with you. I am not religious, but in this late afternoon of my life, I have encountered and begun to study Buddhism. I'm no expert in Buddhism, but I like a lot what it seems to teach. And I especially like the branch of Buddhism called Metta Buddhism, M-E-T-T-A, or loving kindness. Among the central tenets of Metta Buddhism is one that's simple and familiar, and that we all know. It's very hard to heal in the world without first being kind to ourselves. And a common mantra, an idea to meditate on, to think on in Metta Buddhism goes something like this. And I invite you to go through it with me. You can settle comfortably in your chairs, feel the weight of your body settle in. If you want to close your eyes, do it. And just reflect for a moment. The particular mantra I personally love goes like this. May I feel safe and protected. May I feel happy. May I feel healthy as my body allows. And may I feel at ease. That's not a prayer. There's no higher power being invoked. It's simply a support to kind of come into contact with ourselves and begin to feel caring for ourselves. Let's try it again. May I feel safe and protected. May I feel happy. May I feel as healthy as my body allows, and may I feel at ease. Not a prayer, but maybe closely connected to the ikigai that Kedar was teaching about yesterday morning, a matter of purpose and connection. Then as those thoughts sit in, if you want to come along with me, you can turn your attention to someone else in your life, someone you love, perhaps. That's my wife, Anne. Or maybe someone you're having difficulty with, even dislike at the moment. And think calmly, may she feel safe and protected. May she feel happy. May she feel as healthy as her body allows. And may she feel at ease, at peace. And in the teachings of this branch of Buddhism, we are guided to think then about oneness, the whole connection. Because I think in the Buddhist tradition, the concept of self is thought to be an illusion. We are all connected. There's only one. There's only one whole, and we are connected to it all. And so we can say, make all beings feel safe and protected. May all beings feel happy. May all beings feel as healthy as their body allows. And may all beings feel at ease, at peace. I'm the father of 4, a pediatrician, grandfather of 8, and whenever I get into this realm, I start to think about children. I can't stop thinking about children. Think about the children of Gaza and Israel nowadays, the children of Kiev, the children of Yemen or South Sudan or Darfur or the Tigray of Ethiopia, the children of Newtown and Parkland and Uvalde. And now we can think, may they feel safe and protected. May they feel happy. May they feel as healthy as their bodies allow. And may they feel at ease. As I said, I'm not religious, but I have seen magic, and I want to tell you about it. Anne, who you just met, is my wife of nearly 50 years. And Anne is quite an athlete. For much of her life, she has cross-country skied, swum, biked. She hiked distances that leave me exhausted, dragging behind her. In 1997, Anne was hit by a mysterious spinal cord disease. It's unexplained even to this day, and it made it hard for her to walk. But she adjusted. She adjusted by finding sports that she could do, including using an electric assist tricycle. It's called an ice trike, that she could and did ride 30 or 40 miles at a time, often every single day. Anne has logged over 4,000 miles on this particular e-trike just in the past 2 years. Nothing stops Anne. But in the summer of 2022, Anne began having trouble. First, she was just slower than usual on the mountain trail behind our house, and then worse, and then worse. And by late July of 2022, Anne couldn't walk across a room without stopping. Specialists at Harvard found the cause. Anne had had a cardiac pacemaker inserted a decade before that, and the wire lead that went through the tricuspid valve to pace her right ventricle had, over that decade, completely destroyed that heart valve. It obliterated it. For all intents and purposes, Anne had no tricuspid valve at all. So she was in heart failure. That was the answer. The treatment, urgent, was to replace Anne's own tricuspid valve with an artificial valve. And that is where the magic started. We searched for the cardiac surgeon with the best reputation for that very difficult operation, tricuspid valve replacement, and we found him, and he happened to be in our own backyard. He was Dr. Tor Sunt at Massachusetts General Hospital. Dr. Sunt was as gracious and polite and open-minded a doctor as we had ever met, and he operated on Anne right away. That's so easy to say, he operated on Anne. But those 4 words encode an epic journey. It was a saga of 96 minutes on a heart-lung machine, 8 days in the cardiac ICU, step-by-step restoration of Anne's cardiac strength, her heart rhythm stabilizing, her fluid balance, kidney function, breathing, mental capacity, nutrition, so much more. And then a week more in a step-down unit, followed by 2 weeks in rehabilitation before she could finally come home and begin to walk again. I lost count of the medications and the tests and the images and the therapies, hundreds of them, that walked Anne back from the brink. I lost count as well of the dozens and dozens of people, from the surgeon to the medics to the nurses, pharmacists, nutritionists, physiotherapists, electrophysiologists, housekeepers, porters, who made up Anne's vast team. Anne summarizes it this way. She says, "Open heart surgery is not for wimps. It's also not for heroes, no more than a symphony is, or an opera. The complexity of what Anne went through, the harnessing of dignity and competence and dedication to truth and kindness of scores and scores of people who came together to save her, required cooperation beyond estimation." And by the way, that included me. Countless times while Anne lay on the hospital bed, experts asked me what questions I had, what ideas I had, what I was noticing, what I would suggest. I became, through their generosity, part of something much, much bigger than myself, a vast team. So we fast forward to now. Well, this summer, just a couple months ago, less than 12 months after her August surgery, Anne hardly missed a day of riding her e-trike 20 or 40 miles. She's planning a trip of 250 kilometers in the Laurentian Mountains of Quebec next spring. I can't wait. And weather permitting, on days that Anne does not bike, which are few, or even on days that she does bike, she swims half a mile in a nearby lake. And by the way, Anne works more than full-time as the Director of Sustainability for our home city of Newton, Massachusetts. She's doing her best to save the planet. Anne, in short, is back. Now, why am I telling you such a long story? Well, in part, of course, it is my homage to those multitudes who gave my wife back to herself and back to me. How could I ever say enough to thank them? But I'm telling you the story also for another reason. I think it's an even bigger reason in some ways, and it is that I am worried. I am worried about the accumulating list of struggles in which we are losing. We are failing more and more to meet the needs of our time, not just in healthcare, but even more in the greater human projects of equality and sustainability, investments in our future generations, and of course, peace. You don't have to look any further than the tragedy unfolding in Israel and Palestine for evidence that though human beings as children universally abhor cruelty, cruelty wins. We lose the trail of kindness. Our planet burns. We have all the evidence we need that that is so, and all the knowledge we need to stop it, and yet the planet burns. Inequality in wealth and in hope reaches ever new heights, though we could, if we wish, we could end poverty. Hunger, let alone famine, is not predestined. It is not inevitable. We create it by what we choose not to do. So for me, there's a paradox living in the story of the miracle of Anne's care. On the one hand, just look at what we can do. Look at the near perfection in communication and handoffs and shared learning and technical mastery applied without compromise, and I must say with endless kindness in Anne's story. So many people helping so well and so much. And yet, on the other hand, survey a world of conflict isolation, unmet needs, suspicion, fragmentation, war. A world in which the whole is much, much less than the sum of its wandering and dissonant parts. We are rescuing defeat from the possibility of success. Dr. Sunt's team came wonderfully together, and yet for existential human crises, we fall apart. Let me tell you another story. It's shorter, if I may. In early September of this year, I traveled to Paris, France. It was for a small multinational meeting on healthcare and climate change. It was sponsored by the Commonwealth Fund, and the meeting was wonderful. It was just about 24 leaders sharing their stories of national and subnational innovations, all aimed at reducing healthcare's carbon footprint. Each of the participants was just celebrating the achievements of their own, but also mainly of others. We're proud to share. Now, on that trip, I was suffering considerable pain from, as it happened, bursitis in my right hip. I couldn't stand up for more than a few minutes. And for the first time in my life, I was relying on a cane, a walking stick, just to get around. I did manage to get around. I got to the Louvre Museum, for example, where I was delighted to learn that wheelchairs were on loan for free. I happily borrowed one from my visit there. So for the first time in my life, for those 3 days, I was noticeably, although temporarily, disabled. I had the indicia of disability for everyone to see, my cane, and at the Louvre, my wheelchair. What I experienced was, to me, a kind of another miracle of sorts. From the moment I started using my cane, strangers showed up to help me, people I'd never met before and whom I will never possibly meet again, paused in their day without my asking them to, and they came to assist me, opening doors, easing me over curbstones, stopping traffic so that I could cross, waiters fetching me anything I wanted to help with my meal, bicyclists and buses slowed or stopped for me. At the taxi stands, crowds parted spontaneously, and they ushered me smoothly to the front of the line. The people who didn't find occasion to act encouraged me with their head nods and their eyes and their smiles. All I was doing was limping a little and leaning on a cane. I wasn't starving or thirsty or wounded or homeless or cornered or fearful. I was just a little lame. But in those 3 days in Paris, the number of acts of kindness to me, big ones and small ones, numbered not in the dozens, but in the hundreds, truly hundreds. And I asked for not a single one of those. They came unbidden. Each was freely offered, and never, not once, did I have the opposite experience of someone's exasperation at me for the inconvenience I was causing or the privileges that were being extended to me. Excuse the expression, but what the hell is going on here? A flawless team of dozens of people guiding Anne back to bike in the Laurentian Mountains. Hundreds of pure strangers kind of circling me with their safety net. And yet, in other places and at other scales, we see nothing but conflict, nothing but separateness, nothing but fear, nothing but fences, other. I will tell you one thing that was not behind my miracles. It was the pursuit of lucre, profit, greed. Of course, to save Anne's life took resources, a lot of resources, but at the individual level, there was no incentive operating in the usual external sense, no market forces, no competition. There was no one aiming for the victory of one person over another, or even one organization over another. Dr. Sunt's only enemy was an injured heart, and which he would overcome in the company of a vast team by making the heart whole. Those who gently ushered me to the front of the taxi line were winning no game or no prize. If I had tipped them, it would have been monstrous, wrong. It would be deeply out of touch with their shared humanity. My Australian friend, Kath Kroc, is a pediatric oncologist in Melbourne, Australia, where I just was. And Kath has spent years diving into that pool, no, that ocean of human kindness in her work with Mary Freer, which they have called the Gathering of Kindness. It started in 2015, and I attended the full-day Gathering of Kindness in Melbourne barely 1 month ago. In their self-description, they talk about bringing together people from inside and outside the healthcare sector, actors, healthcare workers of all kinds, artists, researchers, musicians, innovators. We, says Kath, ask you to reimagine the healthcare experience by placing kindness and trust and respect as the fundamental guiding principles of the healthcare system. That is, I think, her ikigai. Her personal story includes a growing sense of dismay and then horror at the pain that was being suffered by children with cancer undergoing treatment without attention to their emotional and even physical needs. She converted that to action. But Kath Kroc is by no means alone. Note the project called Civility Saves Lives. It's organized by a UK physician and emergency and A&E doctor, Dr. Chris Turner. And the name of the project tells you what its theme is. Civility Saves Lives. Or the movement called Learning from Excellence. That was started by a single Birmingham Children's Hospital pediatric intensivist, Dr. Adrian Plunkett. It's now a national and international movement, learning from the best and thanking people for what they do. Or the What Matters to Me global movement of Susan Edgman-Levitan and IHI's own Maureen Bisignano and Dr. Michael Barry originally. You can note Steve Swenson's forthcoming book on kindness. And of course, just in these days, Kedar's opening keynote and the heart and generosity and connection to purpose and kindness therein. Every one of those also builds on the forces of generosity and mutual respect and celebration. What could be more obvious? What could be more redundant? How unnecessary to imagine a healthcare system infused with kindness and trust and respect. That's sort of like reminding us that water is wet. What else could healthcare be? Wouldn't unkind healthcare be a pure contradiction in terms, the ultimate oxymoron? Well, I wish that were so, but it is not so. You take a clear-eyed and an honest look at what's happened to healthcare in our time, what it is that makes a gathering of kindness an exceptional event where it already should be abundant beyond measure. I'm looking for an explanation. Now, I've just finished reading a book that I rank as the most important one of the year for me, possibly even of the decade, and I think it does offer part of an answer, and I want to share it with you. The book is called The Big Myth. It was written by historians Naomi Oreskes from Harvard and Eric Conway from Caltech. Oreskes and Conway are the authors of an earlier and widely admired book, published first in 2010, called Merchants of Doubt. The Big Myth, their book this year, builds on that first book, Merchants of Doubt. Now, what is the myth that Oreskes and Conway talk about? It is a falsehood. It's one with enormous traction. Indeed, in the United States, and maybe even in this room, nearly unassailable stature. It is the myth that markets, competition, are the best route to excellence, that in effect, competition is the best route to results in social systems. So deeply has this myth taken hold in our country, at least, that if you question it, You court attacks about naivete and name-calling. You'll be called socialist or communist, maybe. It's the myth that capitalism and freedom are inescapably linked, that you cannot have one without the other, and that government fails as a solution in the face of the magic of the market, free enterprise, the so-called invisible hand. One of the main architects of this belief system came out of the Chicago School of Economics. It was Professor Milton Friedman, celebrated for his conviction and his campaign to convince us that freedom and capitalism are connected. The economic market, he wrote, provides a greater degree of freedom than the political market. Friedman said in South Africa in 1976, as he encouraged the citizens of that country not to fuss over apartheid, but to preserve and expand their market-based economy. I don't know what to say about that. How you had the, chutzpah is the word, to go to South Africa and say, don't worry about apartheid, it's markets you need to perfect. Oreskes and Conway label the myth market fundamentalism. This is George Soros's definition of market fundamentalism. Soros says it's the doctrine of laissez-faire capitalism that holds that the common good is best served by the uninhibited pursuit of self-interest, a belief that Soros absolutely rejects. In Oreskes and Conway's book, The Big Myth, they trace the history of the takeover of this myth, the route to its current hegemony. I really do urge you to read the book. It's a tough read, a long book, but I think it needs to be taken seriously. Very, very briefly, the unquestioning faith in markets was not always there. It took over in the United States in the mid-20th century, not based on evidence, but rather because of the conscious, planned, relentless, indeed conspiratorial salesmanship, the continual use of propaganda, financial investments, political pressure, and scientific distortions by a relatively small number of incumbent, powerful, wealthy corporate interests and the academicians like Milton Friedman and the public figures whom they hired and showcased to give a veneer of scholarly credibility to the belief system that served their own interests. A Stanford Business School professor, Anand Admati, writes of the subtle power of deception for profit and control over narratives, particularly in situations where the public can be easily confused. And boy, do we have in healthcare a situation in which the public can be easily confused. These people were in many cases the same self-interested power centers, wealthy incumbents who tried to suppress and contradict evidence on smoking and lung cancer, and thereby stalled public health regulation in this country for decades. They caused millions of needless deaths. They were the same incumbents who resisted and continue to resist and falsely contradict the overwhelming scientific evidence of the causes and consequences of global warming, no longer a matter of any scientific controversy, and undercut the urgency of action to mitigate greenhouse gas emissions from which we now may never recover. They fought against evidence and action on acid rain, the chemistry of the ozone layer, and in favor of corporate monopolies. These fights continue. They take the costly form nowadays of undercutting public trust in science itself. They purvey misinformation. They stall action on facts. They attack authentic, committed experts. And as Oreskes and Conway put it in their first book, they merchandise doubt. The cost of this process in slowing our progress to stop climate change and end greenhouse gas emissions is literally an existential threat. A unifying theme in all of this obstructionism, all of this myth-making, is that governmental action, social policy, as an alternative to markets, ought to be rejected, blocked, and despised over and over again. Incumbent, self-interested, wealth-concentrating forces warn everyone that any government action alleged to be in the public interest is a foot in the door for the plot to end both freedom and capitalism. Our product, said one of these quoted in Oresky's and Conway's first book, our product, they said, is doubt. If we can cause the American public to doubt the scientific solidity of a conclusion, we can win. That's hogwash. Even Adam Smith, whose book, The Wealth of Nations, is really among the gospels for the market fundamentalists, he said nothing of the kind. The Wealth of Nations includes very clear statements by Adam Smith of requirements for social action, governmental intervention, to mitigate against the many ways in which markets fail, to the immense risk and disadvantage of people who lack wealth, and to the neglect of urgent, even existential causes with no market interest. This is the blurb to end all blurbs, as you find Thomas Jefferson saying on the subjects of money and commerce, Smith's Wealth of Nations is the best book to be read. Yeah, but you have to read it correctly. And Oresky's and Conway show how the merchants of doubt distort, ignore, censor Adam Smith's own writing to undercut the idea that we better do collective things together and that markets won't solve it. Central to the case is what economists call externalities. These are the social and distributed costs of private action. When the owner of a coal-fired power plant adds greenhouse gases to the planet's fragile atmosphere, that owner does not pay his or her share of the costs of climate change, the costs of fires or floods or famines or storms, the population dislocations that greenhouse gases cause. Those costs are not in the price of what the owner sells. I want to share a fact about that particular threat, climate change. If you take a basketball and you wrap it with one layer of saran wrap, that thickness of saran wrap exactly is in proportion to the size of our atmosphere. All human life depends on that thin layer of saran wrap around that basketball. We are dealing with fragility here, and yet the costs of impairment of that fragile essential resource are not in the price of what the owner sells. That's an externality. Others pay. The owner reaps. It's an externality. When labor practices exploit the condition of laborers who have no real choices in their work, the manager reaps while someone else pays the costs of the consequent diseases and social disorder and human suffering, externalities. Adam Smith, the alleged god of market fundamentalism, the free market, the priest of the invisible hand, which was the mechanism allegedly through which market forces optimized outcomes. Adam Smith knew, and he stated, that government, we together, must act through policies and laws and taxation and regulation, collective action, to prevent or at least mitigate these external costs that we all otherwise bear. Oresky's and Conway quote the novelist Kim Stanley Robinson, who said, "The invisible hand never picks up the check." Healthcare has by no means escaped the big myth. Indeed, I cannot think of a single developed nation that I have worked with in the past 3 decades, and there are many, that is not toying with, even adopting wholesale marketization of healthcare. Some invite private enterprise directly to cook in their kitchen. Others try to create internal markets, dividing government functions into purchaser and payer-provider roles with a wall between them, as if competition would lead us out of trouble instead of into it. My own country, the US, is in that regard the worst of the lot, where year by year the interests of commercial insurance, private equity, and drug company profiteering, to name just a few, have displaced the public interest in better care for individuals, better health for populations, and lower per capita cost. It is really no mystery at all why the U.S. is spending nearly twice as much per capita on healthcare as any other wealthy nation, yet ranks 30th or 40th in the world, sometimes lower in the health and well-being of our population. We are relying on a myth, the myth of market fundamentalism. And as evidence of failure grows, the protectors of that myth, who benefit from the myth, claim that we need more market forces, not fewer, less government intervention, not more, represented in part by the takeover of healthcare by private investor interests. The house is on fire, and they propose to douse the fire with gasoline. The externalities are immense. The health of populations depends in very large measure on the social conditions in which people live and work, and play, and are born, and age, and die. That is scientific fact. And yet the money seized by private interests in American healthcare, justified by the myth of markets, is draining. That money is drained from public and private treasuries that could otherwise invest in food security and housing security and recreational opportunities and a healing criminal justice system, better worker incomes, and mitigating climate change. And make no mistake about it, when profit-making activity of that type, profiteering, is permitted to ignore the costs of its externalities, when the invisible hand does not pick up the check, those costs will almost certainly settle in the end in one inhumane way or another on the backs of the people least powerful among us, the most marginalized, the excluded, the poor. They who are least able to pay end up with a check. So why shouldn't they? I mean, that's just life, right? Get real, grow up. The world's just not fair, right? And so when a basic old drug for lead poisoning, EDTA, got into short supply this year, an exploitative, profiteering drug company called Rising got control of it and jacked the price up to $32,000 for a course of treatment for an old, time-honored, and simple drug. Bravo, markets, victory. The invisible hand never picks up the check. Kids with lead poisoning pick up this check, or Medicaid does. How in God's name could we allow this to happen? This is a conference on healthcare quality, not economics, and so why am I playing amateur economist? What does market fundamentalism, right or wrong, have to do with the improvement of quality of what we do? It has everything to do with it. Certain core beliefs, axioms, almost seem to me to underlie effective improvement. It doesn't matter which QI church or you wander into, or what pew you sit in, Six Sigma or Toyota production process or lean thinking or laterally implementation science. If it is authentic, if it's actually going to help get important things to be better, you're going to find the basics the same. Here are some of the basics. That we are interdependent. Improving, especially improving something complicated, requires the coordinated action and shared learning of many people and components. When it's Anne's heart to be saved, that's a long list of very skilled people working together in a hospital. When it's a child at risk in the community to be saved, it's an even larger array of people for whom interdependence is the key understanding. And we need shared purpose to create that interdependence, constancy of purpose, in Deming's words. You can't crew a ship successfully whose crew does not intend as a destination the same port. That we learn as we go. We have to. The maps are only good enough to start with. We need to watch, exchange, interpret, and learn together, redraw maps en route. I loved listening to Peter Lee describe the the learning process, vast learning process about how we're going to get the potential miracle and potential monster of artificial intelligence to be the miracle and not the monster. These basic tenets include that it really, really matters how we treat each other. Some behaviors, some speech foster knowledge of how we depend on each other, what port we aim for or should aim for. Constant learning, shared learning from experience and adjustment, drawing from all the resources we have, the wisdom of everyone without regard to rank and status. And some behaviors do not allow for that. And the basic tenets of improvement include that we can learn best by trying things out, making space safe for innovation and ideas that everyone can bring to the table, whether local successes or local failures, that we will teach us if we will just listen. And when we make walls between us by honoring competition, honoring defeat of each other, we chill the possibility of learning through trying. Now, that's a kind of technical list of some of the concepts that underlie modern continual improvement. I don't think it digs quite deep enough. No, it lacks clarity about the why. It's all about the how, but why do we get better? Why learn? Why change? Why sail the ship at all? Kedar gave us the answer this morning, ikigai, connection to purpose, the engine of all of the how. Now, the market fundamentalists have an answer to this, to the why, and the answer is to win, to beat others, to accumulate wealth from a limited pool. And they will embrace and learn and use improvement science also, to the extent that they believe that they're weapons for victory. I think they will, in the end, though, find their efforts arid. I think in the end, their fields will not flourish for long, although they're dominant right now. They will see in the eyes of their workforce fatigue and cynicism and sadness. And that is because they will have named the wrong enemy. They will have named the enemy to be each other instead of the suffering we're aiming to stop. They are sailing to the wrong port, and their crew knows it. Kedar explained that much more eloquently the morning before this one. There is no meaning, no ikigai in the idea that success is defeating each other. As I crossed a street in Paris one evening on that trip, I came to a curbstone. It was too big for me to step up onto. I just didn't have the strength and couldn't stand the pain. So I tried, I failed, I tried, I failed, I hesitated, and I stalled. And then suddenly an arm grabbed mine, and pulling gently just gave me enough extra force to make it up onto the curb. And I turned, and I saw the bearded face of a man even older than I am, I think. And he himself was holding a cane. And he looked at me and said, "C'est ça, that's it," in French, "that a boy." And then he smiled and he walked on. When Anne was at her sickest, just a day or two post-op, it was a sign went up in the entrance to the ICU, the post-surgical ICU, notifying me that visiting her would not be possible. I had had, and told them, I had had a remote transient exposure to someone who later tested positive for COVID. And so the rule was I could not see Anne for 10 days. That was the rule. And they told Anne. And she was, of course, desperate. You don't know Anne, and you hardly know me, but take it from me, that restriction was a possible death sentence for Anne. At a bare minimum, it was a certain recipe for physical and emotional complications that would be hard to overstate. Anne and I need each other, period. We had been married for almost 50 years. We met at age 17 as lab partners in freshman biology. Anne was smart enough to know right away that we were made for each other, but, fool that I am, it took me 11 more years before I finally saw the light and we got married. We have hiked together on 5 continents. We've raised 4 children and seen 8 grandchildren into the world. We have navigated through dark waters with Anne's prior serious neurologic illness and its sequelae. We climbed Mount Rainier together. Once we were beaten back by storms at 10,000 feet, and then we returned the next year to summit together at 14,410 feet. We built 3 houses together, and we managed to survive choosing drawer pulls and bathroom tiles. I know, as much about Anne as any other human being could, and she knows me better than myself. I know how to hold Anne's hand, and she knows how to hold mine. And now she teetered on the brink of death itself, and a sign on the door said, no entry. Not even really sorry, just that's the rule. I really can't recall a much darker hour than mine, then shaking with tears and anger in the sterile family ICU waiting room, watching a little aquarium and the fish on the wrong side of the door. And then appeared quietly, I didn't hear her coming, at my side, a nurse whom I did not know. She sat down with me. Her name tag said Vivian, and she said she was the nurse manager of the cardiac surgery ICU. And she reached for my hand, and she said, I know the rules. And of course, you know that I have to protect my staff. But she said, I also see you, and I have seen your wife. And let me just ask you to be careful. Now, go to Anne. Why? Markets, incentives, bonuses, winning, margin, income? No. In the eyes of that old man, and in the wisdom and judgment and compassion of Vivian, just may, be all we need to know, all the beacon we need to navigate where we must, in our deepest hearts, want to get to. Leaders who ignore that squander the most majestic resource we have for the betterment of humanity. And I think they squander the success of their organizations and enterprises in their stewardship if they do not understand that. Novelist David Leviathan and Rachel Cohn wrote, maybe it isn't that we're supposed to find the pieces and put them back together. Maybe we're the pieces. Maybe what we're supposed to do is come together. That is how we stop the breaking. Or more simply put, by the amazing Buddhist teacher Thich Nhat Hanh, whom we lost this year, he wrote, we inter-are. We inter-are. The gathering of kindness, indeed, for each of us in our daily presence, for each of us in our presence at work, and for organizations that we, human beings, have created to serve a higher purpose. Is there any possible chance that kindness to ourselves, to each other, to all beings, could actually be our compass, our strength, our binding nature? Economists and others will, I am sure, laugh at me. They will pity my naivete. The visible dynamics of the troubled world do not testify to loving kindness. They testify to battle and winning and losing and war, not peace. Injustice, not caring. Markets, not cooperation. Competition, not solidarity. But I cannot help wondering if the answer instead could be in our hands. The hands of that old man who helped me onto that curbstone, the hands of the housekeeper who touched Anne's hand and shared stories of her grandchildren, the hands that give, not take, and ask in return nothing but a smile of hope and regard. C'est ça. That's it. Good job. I don't know. But the older I get, the more I think that if kindness cannot work at the core, nothing else will come to save us. Let's think again together. May all beings feel safe and protected. May all beings feel happy. May all beings feel healthy. May all beings feel at ease and at peace. Have a safe journey home. Thank you.